Long case assessment is one of the major components in the final MBBS clinical examination in medicine. Good preparation will help students to improve their performance in this long case assessment. In this series of videos, I am going to present you the ways and means of improving your performance through a better preparation in your long case in clinical medicine. I must emphasize, and these videos are mainly targeted for final MBBS examination in clinical medicine who are doing their medicine appointment or having completed their medicine appointment preparing for the final MBBS examination. To improve your performance in the long case, it is important to know first what are the areas of assessment in the long case. In other words, how is this long case assessment is done, the different components in the mark sheet. So I'm going to present you a model mark sheet and the different components where you are assessed and final assessment mark is given. The second important thing is students should be aware the kind of long cases that will come in your final MBBS exam in clinical medicine. For example, it is highly likelihood to have the long cases or the diseases which are more common in the day-to-day admission, such as chronic liver disease, chronic kidney disease, chronic asthma, complicated vascular disease, diabetes, etc. So students should be aware all the important day-to-day management protocols for these patients in the ward. Third, there's a big knowledge component tested in the long case. It is not only the presentation, history and examination. In this discussion part, students must make sure that the discussion is mainly focused on areas where they are more comfortable with. Sometimes students without their knowledge step into an area where they are not very good in the knowledge component. For example, if a long case in diabetes is given, without his knowledge, he might mention painful peripheral neuropathy. When a question is asked from him, let me know how are you going to manage with neuropathy, he might forget all the medications given. So that is not a very good way. So in short, you must try to hide your ignorance in your long case and try to showcase the areas where you are more comfortable with in the knowledge component. Everybody must be aware that common questions are asked in the long cases, not the very rare ones. So the common management protocols followed up in the ward must be followed and students should reveal them in the long case. The other important thing in this preparation is the tone, the confidence, the presentation skill, the language that the students use in the 20 minutes of time. It is accepted that you may make one or two mistakes in the language, but at times for a final MBBS students passing out in a shorter time, expecting to pass out as a doctor in short time, if they make a basic mistakes in English language, either in the nomenclature of medicine, it will be considered as a major mistake and you will be duly discredited for your mistake. So in short, this preparation of a long case, first thing, you should be aware how you are assessed. Two, you should be aware what are the common long cases that appear in the clinical examination. You should make sure that your large body of ignorance is somehow covered and you must try to showcase the knowledge, the skill that you have on a particular subject. And last, you must not forget to avoid even the simplest of mistakes in language during this interview process. Let me tell you the components of the mark sheet in clinical medicine in a long case. It has 9 components. The first component is mainly on the history revealed by the patient to the students, and in this history what is checked is, has the student obtained saline points in the history. Saline points. If you have missed a saline point and he has got into a very minor point, that will be considered as a mistake. And if the information revealed by the students are accurate as far as the patient's history is concerned, then on the examination point, in the long case, the technique of examination is not often checked because the examiner is not going to sit or stand with the candidate. But what is checked is, are the findings revealed by the student are correct or incompatible with the findings given in the bed etiquette or the registrar's notes given to the examiner. So you must make sure these findings are as far as correct. And the technique, of course, is not checked in the long case. That is in the short case where the technique is revealed. Sometimes the third one is the student may be asked to tell the summary of the case. So the summary should be updated summary and should include all the relevant and saline points in the summary up to the time of the management at the time of you taking the history. It is not up to the time of getting admission to the ward. You must reveal after admission also what has happened, what investigation has been done, what treatment has been given, and what sort of information has been given to the patient by the medical staff. Next is you will be asked to reveal your list of problems that you have obtained from the patient. Obviously, the first one will be the medical problem which led to the hospital admission, and the next other problems, either psychological issues or other related financial or family issues as a result of this patient's illness. You will also be asked in the next component with your plan of investigation for this patient. So it is always important to go to this long case examination with a list of investigation you would do on this patient on admission and at different stages, and should also be aware what are the results you are going to expect and how you are going to interpret and act upon following these results. You will often be asked on the management aspects. So management aspect may differ from patient to patient and the different stages. Sometimes the students is asked, how are you going to manage this patient on admission? So you have to imagine yourself as a house officer on duty and say, I would do this, this and that. Sometimes you will be asked on the management step during the course of hospital stay. For example, on the third day of this hospital stay, patient developed acute breathlessness and he was found to have this blood pressure, and how are you going to manage? Things like that. And sometimes you may be asked, how are you going to reveal this patient's diagnosis to the patient? So there you will be required to reveal as a doctor how this some bad news is revealed to the patient. And there may be certain situations where the health education communication also matters. For example, patients with diabetes, what sort of dietary advice that you would give an obese patient, a patient with chronic kidney disease or liver disease, what specific advice. So you should be aware of the specific advice, health education. The last is the documentation. Of course, it is not essential for students to have a detailed document at the final MBBS long case. But in order to make the presentation easy, it is necessary often to have written something in at least in a flow chart manner. On admission, these are the problems. Day 1, these are the problems. During the day 2, day 3, day 4, whatever thing. So not necessarily in a paragraph or complete document form, at least certain points that need to be highlighted in the different component of the history. Family history, these are the points. Drug history, these are the points. Social history. Every component you must write something that is relevant to the particular patient. So these are the kind of 8 to 9 areas that are tested, and often it is important to complete your presentation of history and examination within the 10 minutes of your time allocated for the long case presentation. and make sure you don't go up to about 13-14 minutes and the examiner has to stop you, because then you have about 5 to 6 minutes remaining for the discussion, and that will really reflect bad on you, because you must prepare yourself how to put everything that you gathered in the history, the 40 minutes of your interview, into 10 minutes, salient, accurate, relevant points within 10 minutes. That is a very important thing. You must prepare, practice, rehearse and get used to before coming to the final MBBS long case. And as I told you earlier, the language and other how loud now, often it is not necessary, because it is an interview between two examiners and yourself, and you don't have to shout, but in the same time you don't have to be very low voice, showing that you have a lack of confidence. So you must show appropriate level of confidence, and you must look at the examiners and then show that you know what you are talking about, rather than just reading what we have jotted down. So these are the things that is tested in a long case mark sheet. The next important thing in the preparatory phase of a long case is to be aware of the kind of long cases that would come in your exam. Undoubtedly, these cases are taken from the wards, and what is commonly seen in the wards appear as long cases. So if you make a list of these commonly seen long cases, that would include chronic liver disease in case of males, chronic kidney disease for both males and females, nephrotic syndrome, chronic asthma, and some chronic lung diseases like bronchiectasis, pleural effusions. When it comes to nervous system, it is often things like a patient with a stroke who has recovered to some extent, who can reveal his history, and patients with hypertension with some complications like heart failure or chronic kidney disease again, or a young patient with hypertension. And patients with diabetes are very likely to appear with different problems, maybe a newly diagnosed diabetes, maybe a diabetes for a long time with some complication like nephropathy, peripheral neuropathy, or multiple complications, or needing dialysis, or who has undergone amputation for peripheral artery disease. So complicated diabetes are more likely to appear as long cases. Even ischemic heart disease, that you would appreciate that patients with acute myocardial infarctions are not given as long cases, but patients who are stable, having stable angina, patients who are ready to be discharged after a admission for a perhaps unstable angina, now stabilized and ready to be discharged, could appear as your long case. So what you must do in your preparatory phase is to make a list, and I'm sure this list will not go beyond 20 in my opinion. And if you also will agree that long cases that you see in the ward commonly can be numbered up to about 15 to 20. And you must be aware of the common protocols followed up in the ward for these patients. More than the textbook management, what is done in the ward. And you must also be aware what is done as a gold standard management. Sometimes certain management protocols are not followed up in our setup for lack of resources, but you should be aware that these things can also be done in the ideal setup, in the resourceful setting. So when you are preparing, make a list of long cases that you see in the ward, and make sure you know the commonly followed protocols in the ward and the gold standard management, which may not be followed for different reasons. There's a component of knowledge tested in the long case. Of course, the skills of ability to take a relevant and accurate history and eliciting the necessary physical signs are also tested. But there's a big component of knowledge tested in a long case in clinical medicine. And during this 20 minutes of the whole interview, 10 minutes of time is taken for the discussion. And during this discussion, it is up to the candidate or the medical student to make sure that he highlight and showcase as much as possible that he has adequate knowledge on the particular patient's disease. And at the same time, you will appreciate that nobody is having knowledge regarding everything about someone's disease. So there are gaps in your knowledge. But during this 10 minutes discussion, it is up to the students to make sure he or she does not expose his or her ignorance on the particular patient's particular problem. As much as possible, students should try to showcase and highlight their knowledge on the particular patient. Let me take an example of a patient whom you have received as a young, newly diagnosed patients with type 1 diabetes who are presented with ketoacidosis like picture. So during the management, you will be questioned on probably on the initial steps in the management of diabetic ketoacidosis. So while describing the different steps, you may have forgotten the threshold for potassium, serum potassium, where you give different potassium preparations, either KCl or. So you must put it at the end of the discussion, because halfway through, often most examiners have a habit, when they realize that student is quite conversant of a particular subject, they will shift gears and get into a different topic rather than going through the whole of the management of ketoacidosis. I hope you understand what I say. So during the management of diabetic ketoacidosis, you must select the area you are more comfortable. For example, if you are comfortable with insulin treatment, you must mention, okay, I will start insulin infusion, and this is how I am going to make the initial calculation, and this is how I am going to administer, and this is how I am going to monitor. And then you can get on to the fluid management like that. If you are not very sure about exact management of acidosis in this setup, unless you are questioned specifically, you must not inadvertently get on to the area where you are not comfortable. So always try to bet on the comfortable areas first and try to leave aside areas where you are not very comfortable. At times you can say, I am not sure. When some examiners keep on asking the areas where you are not comfortable, the best way, rather than lying and telling inaccurate and non-confident answers, say, I am not sure, I would rather read, or I would get an opinion from a senior. That is the best way of managing, rather than telling very rather lies or rather incorrect answers in managing patients. So the highlighting the areas you are aware, your knowledge is a very big component where you can score marks, and you must as much as possible give the full management protocol. If you are aware about the name of the person who has invented this protocol, you can say, I would follow this particular protocol, and then these are the major components. Right. The next one is hiding your ignorance. It is very difficult for anybody to know every step in the management of a particular patient's some components of the illness. So you must not get into that area often. You must try to avoid, unless the examiner asks. But in the examiner asks, you must try as much as possible to tell what you know rather than tell incorrect things. So this is important part in the preparation and getting your performance up to the level of your desire in your long case. Let me finish this short video on preparation for a long case, summarizing the main components. It is important for you to know the components of the mark sheet, which I have given even on slides. Then it is up to you to be aware of the common long cases and make a list and be prepared. 3. During the whole of 5 years that you have gone through in medical school, you have gathered a lot of knowledge, and you must show that knowledge in your long case. And if you have any areas where you are not very comfortable, you must not expose much. The last, the etiquette of a long case. Let me mention it like that. What are the long case etiquettes? The first thing is to, when you come in front of the two examiners, first telling good morning or good afternoon, and be seated nicely, and then introduce your patient, right? Mr. So and so, and say that, rather than without telling anything, come and sit and just keep on reading what you have written. So the patient who allocated to me was so and so. I have taken the history. Let me describe his history. That's some professional way of starting. And in the midway, you must show your confidence. You must not talk very loud. At the same time, you must maintain some tone in your presentation. And very often during discussions, when a question is asked, sometimes the students can start from the question itself. So you can take time to prepare for the answer. That is one good way of taking time. Not to have a pause after the question. So these pauses keep on adding adrenaline to your system. And for a mediocre or some not very good student, these pauses can be very negative. So don't have any pause. When the question is asked, in answering, you start with the question. Then you have some time, and you have filled that 1 minute about few seconds of the question itself, and you can reveal from there. And after finishing, you must always thank the examiners and leave, right? And make sure about this 10 minutes story, you must try as much as possible to finish your presentation within 10 minutes, actually in 10 minutes, rather not very short of 10 minutes also. If you present the whole history and examination in 5 minutes, that also reflect bad on you. So you must make sure you span it around 10 minutes and leave 10 minutes for the discussion. I hope that this will help you to make your long case performance better, and we will go through other different aspects of your long case presentation in the next few videos. Thank you.